as a result of the work that you performed, did you form any opinions with respect to Ms. Heard?
I did.
What were those opinions?
The results of Ms. Heard's evaluation supported 2 diagnoses: borderline personality disorder and histrionic personality disorder.
What is a diagnosis?
A diagnosis is a way that we essentially, that psychologists, psychiatrists, anybody in the mental health field thinks about a disorder. It helps us to communicate a set of symptoms that a person is experiencing, and along with that set of symptoms, it tells other professionals a lot about how those symptoms might have developed, how that person might behave, perceive the world. It also drives treatment. The real purpose is to determine what sort of interventions will be most effective for the person.
Yeah. Previously, you made reference to, I think you called it the DSM-5. What factors that you considered in determining that Ms. Heard suffers from personality disorders? And one of them, I think the last one you said before you left, was self-report. What do you mean by that?
So the self-report would be things that Ms. Heard indicated to me specifically. So there were a couple of characteristics that she noted in her self-report that were consistent with these personality disorders. The first was actually my own behavioral observations of her based on her self-report. So one of the hallmark characteristics of histrionic personality disorder is sort of a overly dramatic presentation. We call this impressionistic speech. So it tends to be very flowery. It uses a lot of descriptive words like magical, wonderful, and it can go on for quite some time, and yet it really lacks any substance. So at the end, you're left wondering what was just said or what the answer is to the actual question. So that occurred a number of times. And it also represented the quick shifts you'll see between emotions. So she would suddenly be one way, and then she would become very animated or very sad. And when people are displaying these emotions with this personality disorder, there's a sense of shallowness to it. People who are observing them will feel like it's almost play acting, and they might not be able to put their finger on it, but part of it is because of the rapidness with which the person can switch emotions, and also the lack of substance. They don't really refer to, I feel this way. They might describe emotions, they might describe events, but very rarely, and Ms. Heard did not say, I feel vulnerable. She never really indicated a vulnerable feeling of her own.
What did you learn about Ms. Heard from the results of the MMPI-2?
Quite a bit. I wrote up a 25-page interpretation outline. It has numerous scales. So one of the reasons I like this measure so much is that it can tell you so much about multiple different traits and tendencies and mental issues. One of the primary things I learned was that she had a very sophisticated way of minimizing any personal problems. I also learned that she tends to, there were a number of characteristics that were consistent with the eventual diagnoses, but some of the primary characteristics, and I'm going to try to condense 25 pages here, were essentially externalization of blame, tending to have a lot of inner hostility that is attempted to be controlled, a tendency to be very self-righteous, but to also deny that self-righteousness and to judge others critically against these sort of high standards for moral value, but also to deny doing that, essentially to claim that one is very non-judgmental and accepting, and yet very full of rage, really. And these aren't facts, but her scores essentially correlated, so they were consistent with other people who obtained these scores who have been shown through many studies to have these very specific traits. So externalization of blame, a lot of inner anger and hostility, sometimes that anger among these groups with similar scores These people might have that anger kind of explode out at times. They tend to be very passive aggressive. They may be self-indulgent, very self-centered. They could use manipulation tactics to try to get their needs met, very needy of attention, acceptance, approval. They tend to distance people who are close to them. Initially, they may seem very charming. They're very socially sophisticated, actually. That was a major component on there. They have a capacity to kind of offer some of their faults, but in a way, but only the ones that people think of lightly and can all relate to. And so they can present as very fair and balanced, but in actuality, they really might be very judgmental of others and unaware of problems in their behavior and their thinking. Emotional reactivity is very common in the diagnosis. So essentially, like I said, there's instability in emotions. People with borderline personality disorder are often misdiagnosed as having bipolar disorder because they can be up and down. They can look very depressed, then they can look very elated, but these changes are happening within a matter of hours. Somebody with bipolar disorder, this is a clinical depression lasting days, weeks, a clinical mania where sometimes they even need to be hospitalized because they're so grandiose. They clear out their bank account and go to Vegas and spend it all. They're acting in some very bizarre ways. With borderline personality disorder, you're having these fluctuating moods constantly. And again, this hypersensitivity to being slighted or feeling offended, really driven by the fear that if you're offended or slighted, if the therapist comes in 2 minutes late, or if somebody shows up to dinner 2 minutes late, that they might be abandoning you. And it's not as if the borderline is considering themselves abandoned in that moment, but they just know that they have this overwhelming emotion and there are no attempts to control that emotion. There are no attempts to regulate it. So if they're in the middle of the restaurant and they feel offended, they're going to start the fight. People are going to see it, or they might just start crying or break down, but they'll make a lot of accusations, and that reactivity is when you're going to see a lot of this escalation in the bizarre behavior. They can react violently, they can react aggressively, they will often physically prevent their partner from trying to leave if their partner wants to get space from all of this intense emotion, and oftentimes they will be abusive to their partners in these situations. Sometimes they'll physically restrain them from leaving and become injured that way, but also people with borderline personality disorder, it seems to be a predictive factor for women who implement violence against their partner. And one of the most common tactics that they'll use is actually physically assaulting and then getting harmed themselves. But mostly, we call this administrative violence. So essentially, this is saying that they'll make threats using the legal system. So they might say that they are going to file a restraining order or claim abuse, or they might do these things to essentially try to keep their partner from leaving. In the moment, again, they're not consciously thinking, I'm going to keep my partner from leaving right now. They're just thinking, I can't stand this. I hate my partner. They went from idealizing to suddenly devaluing because of the hurt, and they'll do anything to express that big emotion of anger. On the MMPI-2, yes, there was no exaggerated profile. I also gave her the CAPS-5. I don't know if you'll remember, but that is the clinician-administered PTSD scale consistent with the DSM-5. And on that, there were signs of gross exaggeration. I also looked at the test results that were provided by Dr. Hughes, and on an objective test of trauma, there is a scale specific to intentional exaggeration on that test, and Ms. Hurd was in the 98th percentile, meaning that she had engaged in extreme levels of exaggeration.
Damn.
Thank you.
Trained to stay away from making any sort of opinions, understanding that most of the time, and most of Ms. Hurd's providers were just treating Ms. Hurd. They had never so much as done an initial interview with Mr. Depp and gotten his whole life story or his symptoms or his side of any of it. And they're going to be advocating, and the treatment relationship is about helping your client achieve well-being, not making formal psychological or psychiatric opinions.
So you're asked a question about a series of doctors. Dr. Cohen, treating physician?
Yes, he was a psychologist.
Yeah. Dr. Banks, treating physician?
Dr. Banks, yes, treating psychiatrist.
Dr. Anderson?
Yes, treating psychologist.
Every one of them had to take Amber Heard at his word, right?
Yes.
Oh, overruled on that.
Thank you. No further questions.
All right.
Taught, we're trained to stay away from making any sort of opinions, understanding that most of the time and most of Ms.